This podcast represents a brief history of the law relating to the issues raised. This should not be relied on as a substitute for professional advice. Specific legal advice should always be sought in relation to any particular circumstances, and no liability will be accepted for any losses incurred as a result of reliance on this podcast by those relying solely on this podcast. Welcome now to Hicksons Health Hour, the podcast series that explores a variety of current legal health topics. Throughout each episode, hear from different members of our health team with expertise in the area. Hello, my name's Stojkova and I'm Special Counsel in the health team.
And I'm Jessica Zhang, Associate in the health team.
It's all the buzz at the moment, but what actually is artificial intelligence and what part does it have to play in the healthcare setting? Those are the issues that we'll be exploring today. So to begin, at the very beginning, what is artificial intelligence, or AI, as it is most commonly known?
AI comprises of any digital system that mimics human reasoning capabilities, including image pattern recognition, language processing, and abstract reasoning and planning. The tsunami of AI has arrived in medicine, seeping into every clinical specialty.
How can AI potentially improve access to services?
With the continuous development of cloud technology and AI-assisted diagnosis and treatment, this new way of healthcare delivery will help to improve access to service in underserved communities and countries of lower income. While working at Hicksons Lawyers, we come across various medical negligence cases, and unfortunately, at times the cause of an adverse outcome is the limitations in the care provided due to resourcing pressures. The effective use of reliable AI technology in the health space will hopefully work as a second pair of eyes and be able to cut down the time on repetitive tasks which do not require human oversight.
So the issue becomes how to introduce the use of these revolutionary changes into practice in the face of limited regulation oversight, given that these technologies are developing at a rapid speed.
While some AI tools used in healthcare are regulated by the Therapeutic Goods Administration, known as a TGA. For example, the TGA regulates therapeutic goods that meet the definition of a medical device, which include AI-enabled software if it has a therapeutic use and meets the definition as set out by the TGA. AI would generally be considered a medical device if it is intended to be used for, among other things, the diagnosis, prevention, monitoring, prediction, prognosis, or treatment of a disease, injury, or disability, or alleviation of or compensation for an injury or disability, investigation of the anatomy or of a physiological process, or the control or support of conception.
Are all AI tools regulated by the TGA?
Generative AI tools used in a clinical practice, such as AI scribing, are usually intended for a general purpose and do not have a therapeutic use or meet the definition of a medical device, and therefore are not regulated by the TGA. However, software, which assists in reviewing radiology imaging, would likely fall under the definition of a medical device. Health practitioners can contact the vendor or search the Australian Registrar of Therapeutic Goods to check if the tools they are.
But surely there are obligations that have to be met whether an AI tool is or isn't regulated by the TGA.
Regardless of whether an AI tool is regulated under the TGA, health practitioners are required to meet AHPRA and national board obligations, and just like with the practice of traditional medicine, are at risk of litigation if improper oversight is not utilised. Recently, AHPRA published a guidance which explains how existing responsibilities in the National Board's Code of Conduct applies when practitioners use artificial intelligence in their practice. AHPRA identified 5 key principles: accountability, understanding, transparency, informed consent, ethical and legal issues. There are a number of parameters, including the following. Health practitioners must apply human oversight and judgment to their use of AI. Those who use AI scribing tools must check the accuracy and relevance of the records created using AI. All tools, software, should be appropriately tested before they are used in clinical practice to ensure they are fit for purpose. Health practitioners must understand how the AI collects, stores, uses, and discloses data, having particular regard to privacy and ethical considerations. Practitioners should inform patients and clients of their use of AI. Practitioners must seek informed consent from their patient or client and should note their response in their health records before they input any patient data into an AI or record any private conversation.
So, whilst it seems that AI in healthcare has been welcomed, there are warnings to heed to.
AHPRA and the national boards have welcomed the use of AI in healthcare, citing its potential to improve health outcomes and reduce the administrative burden and burnout amongst health practitioners. However, AHPRA's guidance makes clear that individual health practitioners remain ultimately responsible for any use of AI in the course of their medical practice. This places the onus on practitioners to fully understand the AI tools they are employing and also to critically analyze AI's recommendations before applying them to the treatment of patients.
So, then what's the black box that's spoken about?
Well, practitioners should be wary of the black box problem. This problem is an inability to understand or describe exactly how an AI reaches its decisions could pose a particular issue in the context of healthcare, where it could pose challenges for informed consent. The Nuffield Council on Bioethics has raised a concern that if AI systems are used to make a diagnosis or devise a treatment plan, but the healthcare professional is unable to explain how these were arrived at, this could be seen as restricting the patient's right to make free, informed decisions about their health.
Surely a minimum level of understanding is required before employing AI.
Practitioners who choose to utilize AI tools need to have, at a minimum, an understanding of the basic concepts of this technology. They need to understand that AI recognizes pattern that may not be known to biologists or conventional clinical experts. The black box in AI medicine needs to be at least partially open to biological mechanisms and understanding so that clinicians can convey the message to their patients that the decision is based on solid ground.
Clinical judgment, however, has to prevail.
Practitioners cannot simply utilize the AI's outputs without the use of their judgment. This is because in the event of adverse outcomes resulting from AI use, the practitioner may be held accountable regardless of whether the error arose because of the AI system's failure or if they have been approved by the TGA. Notably, health practitioners must hold appropriate professional indemnity insurance for all aspects of their practice, including their use of AI.
So let's take a closer look at two examples of where AI in the healthcare space have been adopted and are developing in practice. Firstly, the prevalence of AI-based medical scribing tools, known as AI scribes. What exactly does that entail?
An AI scribe listens to conversations between a patient and doctor and then uses generative AI to compile a structured clinical note.
Consider the benefits of an AI scribe from a medico-legal perspective.
The use of AI technology can allow a more detailed documentation in the patient's medical records, improve decision-making as it is aided by accurate, detailed, and up-to-date clinical notes, and it reduces the risk of transcription errors.
But where there are benefits, there are always risks.
There are, of course, potential risks with the use of AI scribes, as with any technology. The risks include compromised patient decision-making through an over-reliance on the tool, unknown clinical efficacy due to lack of regulatory oversight from the TGA, And importantly, there could be privacy breaches if patient information is not managed in accordance with the Australian privacy rules. These risks need to be balanced, and protective safety nets need to be implemented in conjunction with the integration of AI technology in the healthcare system.
There is also another example of AI in the health technology sector. This uses machine learning devices that can review radiology and detect abnormalities.
This is particularly fascinating. Computer vision, CV, AI recognizes and analyzes images and videos mimicking human sight. CV is used in facial recognition, object detection, and self-driving cars. CV, together with machine learning, is used in radiology and medical imaging to interpret images and detect potential abnormalities.
The benefits of AI in the radiology sector appear to be obvious in that it has the potential to cut down the time required to review imaging. In public hospitals, the demand for urgent imaging is limited by resources, and requests can be bumped down by patients who present with more serious medical issues. So the introduction of AI in healthcare begs the question as to whether it will replace the healthcare provider.
The purpose is not to replace the healthcare provider in making decisions. This is underscored by AHPRA's recent guidance on AI use, where the regulatory system recognises the benefits of this technology, but also emphasise that it is to be used in conjunction with, and not instead of, good clinical judgment.
And what about its impact on the law?
As to how traditional tort law will accommodate the use of complex AI, it is difficult and very much evolving. On one hand, consumers may choose to pursue claims against the AI manufacturer in the form of product liability. This may be applicable when there is a clear mechanical flaw in the product. However, under the current Australian regulation system, there is no requirement to use AI technology, and a clear responsibility is placed on the shoulders of medical practitioners. It does appear that any liability, even if it is apportioned with the AI manufacturer, will primarily lie with the medical practitioner.
It seems inevitable that healthcare practitioners and organisations should prepare for a changing and complex landscape with an increasing focus on balancing the benefits of AI with robust safety measures and ethical considerations. It will be interesting to see where this space goes.